What I love about the stellate ganglion block is it is a rapid reset of the autonomic nervous system, specifically the sympathetic fight or flight. The reason I went into emergency medicine is I love to see rapid results. And that's one of the reasons why I opened up the ketamine clinic is the studies have shown that it can be rapidly effective in treating patients for depression and anxiety and PTSD versus trying something for months to years to see if it works. So that's what I've noticed about the stellate ganglion block is when it's effective, and again, it's not 100%, may or may not work for you. We've seen about an 80% success rate, that doing this block can create changes. And we'll know quite soon whether it's, immediate, whether it's within the next 24, 48 hours, or sometimes a week or two. By doing this procedure, the stellate ganglion block, it's incredibly gratifying to know that I can make a rapid transformation for our patients and to let people know that there are options. There is hope. There's a ton of research happening in this space. And if you're struggling or suffering, or if you know of someone, please let them know about the stellate ganglion block. It really is the future and one of the most powerful tools that we can do for PTSD and anxiety-related symptoms. Are you wondering if getting a stellate ganglion block is painful? If so, you are watching the right video today. I'm Dr. Ko from Reset Ketamine in Palm Springs, and in this video, I want to walk you through what the procedure feels like, what to expect during and after the SGB, and whether it's really uncomfortable. All right, so let's answer the question, does it hurt to get a stellate ganglion block? The short answer is, it can be uncomfortable, but most patients find the experience manageable. I would say they rate it on a scale of 0 to 10, with 10 being the most uncomfortable and 0 being none, maybe a 1 or a 2 or a 3. So during the procedures, here's what you can expect. First, there's going to be a topical cream, a numbing medicine that is applied to the skin. In addition to that, we're going to use a second, smaller needle and find the appropriate locations. You might feel at this stage a small pinch or a slight burning sensation, similar to getting like an anesthetic at the dentist office. Next is the actual injection with the special ultrasound needle. Once this whole area is numb, the anesthetic is carefully injected near the stellate ganglion, which is a bundle of nerves in your neck. You may feel a little bit of pressure or kind of a spreading warmth in that area, but because of the numbing medication, pain is usually very minimal. And the injection only lasts a few minutes, and most patients, again, will report little to no pain beyond that mild discomfort. Now, what happens after the procedure? Well, after the SGB, you may experience some temporary soreness or mild bruising where we made those small injections. You may notice a slight hoarseness in your voice or a feeling called globus, which is like there's something stuck in the throat. In addition, you may notice kind of that eye on the side where we do the SGB. It might be a little bit droopy, it might be a little bit red. Again, all of these symptoms are temporary and typically resolve within 4 to 6 to 8 hours. And usually within 24 hours, everything is 100% back to normal. So the question is the discomfort worth it? Well, many patients find that the potential benefits of the SGB, such as getting relief from PTSD symptoms, anxiety, chronic stress overload, far outweigh the brief discomfort of the procedure. And if you're worried about pain, it's always a great idea to discuss these concerns with your doctor, and they can walk you step by step of what to expect and address any specific concerns you may have. So let me wrap it up for you. Does an SGB hurt? Yes, there may be some mild discomfort, but it's short-lived and with the numbing medicines, very low pain threshold. The numbing medicine, again, helps minimize that pain, and most patients tolerate it very well. If you're able to go to the dentist and get a cavity repaired, then this is something that would probably be easier than that. Also, please know that any soreness afterwards, temporary, and typically resolves within a day or two. Now, I hope this video helped answer your question, and if it did, please give it a thumbs up. And if you have any other questions, drop them in the comments below. Really appreciate you watching, and I will see you in the next video. Are you or someone you know dealing with PTSD symptoms that seem to linger even after trying various different treatments and modalities. Today, I am here to explain a new procedure called the Stellate Ganglion Block, also known as the SGB, which could potentially help ease some of those symptoms by calming the body's stress response. I'm Dr. Ko from Reset Ketamine in Palm Springs, California, and in this video, we're going to dive into the science behind stellate ganglion blocks, what they do, how they work, and what you can expect if you are considering this treatment option. PTSD can keep the body's fight or flight response switched on, causing a state of hyperarousal and/or hypervigilance. This means that people with PTSD, they might feel constantly on edge, anxious, or like they're always prepared for some sort of danger, even when in that moment they're safe. This response is controlled by the sympathetic nervous system. And when it gets stuck in overdrive, it can feel very challenging to calm down and be relaxed. So what is the stellate ganglion block? The SGB is a procedure where a small amount of local anesthetic is injected near the stellate ganglion. And the stellate ganglion is a nerve bundle near the neck that connects your body to the central nervous system. The anesthetic temporarily blocks this area and the nerve signals, which can help reset the overactive response, which can give a body and your brain a break from this constant sense of alertness. The stellate ganglion sends signals to areas of the brain, the amygdala, hippocampus, that's involved in the stress and fear responses. And by interrupting these signals, the stellate ganglion block may reduce levels of norepinephrine, which is a neurotransmitter linked to stress and anxiety. Think of it almost as like turning down the volume of a loudspeaker that keeps broadcasting stress signals. Some studies show that the block can bring a calming effect and even reduce the PTSD symptoms for weeks to months. The procedure itself is fairly quick, roughly 15 to 30 minutes, and done always under ultrasound guidance and visualization. We find and pinpoint exactly the location that we need to go, and some people will even report immediate benefits following the stellate ganglion block, or even a day later or up to a week later. You'll also have something called Horner's syndrome, which consists of a droopy eyelid, a red eye, maybe some nasal congestion, and an increased sensation of temperature, possibly on the right side of the face. In addition, it could cause a hoarse voice and a feeling of kind of like a lump stuck in the throat. Again, this is temporary, lasting roughly 4 to 6 hours. Once the anesthetic fades off, then all those symptoms will go away and everything will get back to normal, except for that fight or flight response. Now, the stellate ganglion block is not for everyone, but it can be beneficial for some patients with persistent PTSD symptoms, especially when other treatments haven't provided enough relief. So for example, certain patients with a history of a recent heart attack, or if they're taking blood thinners, or if they bruise or bleed easily, or even if they just have a severe fear of needles, that would be a reason not to get a stellate ganglion block. So having an evaluation and consultation with a stellate ganglion block specialist is crucial prior to beginning any treatments. Now, what's interesting is that the stellate ganglion block can work synergistically with other PTSD treatments, whether that's medications, therapy, ketamine infusions. And so for some patients, SGB can help with the body's stress response, which can help the ketamine work on the brain portion and making them more receptive. I almost think about ketamine therapy as kind of like working on the software, whereas the stellate ganglion block is working on the hardware. And having both together, they can offer a more balanced and holistic approach where the SGB works on the physical fight or flight symptoms, and ketamine can help with the emotional processing and relief in conjunction with the SGB. So the combination, bottom line, is that they can work comprehensively and synergistically together in managing PTSD symptoms. I hope this video helped you gain a better understanding of the stellate ganglion block, SGB, what it is, and how they could help in the treatment of PTSD symptoms. I really appreciate you watching, so please like and subscribe so that you can stay tuned on the latest in this cutting-edge field, and I'll see you in the next video. You might be wondering, can a stellate ganglion block help with hot flashes? Maybe you've heard of this treatment for PTSD, but what about menopause? I'm Dr. Ko at Reset Ketamine in Palm Springs, California, and today I'm going to share with you how stellate ganglion blocks may be a non-hormonal option for managing hot flashes and night sweats, especially for those who can't or do not want to take hormone therapy. What are hot flashes and why do they happen? If you have ever had a hot flash, you know the drill. A sudden wave of heat, sweating, and flushing that comes out of nowhere. Over 75% of menopausal women experience these symptoms, but the cause is not fully understood quite yet. The leading theory is that estrogen fluctuations affect how your brain regulates temperature. Changes in norepinephrine and serotonin levels can throw off your body's internal thermostat, making you more prone to sudden sweating and flushing. So what are the common treatments for hot flashes? Well, most doctors recommend one of two treatment paths. First, hormone replacement therapy, HRT. It can work well for many people, but isn't suitable for anyone. Or they may be on hormone replacement therapy, but it's not quite as effective. Those with a history of breast cancer or blood clots could be at certain risks associated with HRT. The other treatment path are non-hormonal medications, which includes, but not limited to, clonidine, which may help reduce norepinephrine release, as well as SSRIs and SNRIs, which can help regulate serotonin and norepinephrine. But what if hormone replacement therapy isn't an option or you don't want to take the medication? And this is where the stellate ganglion block comes in. So what exactly is a stellate ganglion block? It's a simple outpatient procedure where a local anesthetic is injected into the stellate ganglion, which is a cluster of nerves in your neck. It was originally used for chronic pain and PTSD, but now researchers are seeing promising results for treating those with hot flashes. So how do stellate ganglion blocks work for hot flashes? Simply put, the stellate ganglion is a part of your body's stress and temperature regulation system. If you've ever started sweating during a stressful situation, that is your sympathetic nervous system at work. The SGB temporarily blocks this response, helping to reset your body's temperature control. And the result? Well, fewer and less intense hot flashes. At this point, you may be wondering what the procedure is like. So here's what to expect. You're going to be lying down comfortably while a doctor injects a local anesthetic into the neck. We use an ultrasound to ensure precise placement for maximal safety and effectiveness. The entire procedure takes roughly 10 to 30 minutes, kind of depending upon the anatomy. And after the procedure, some temporary effects will happen and are normal. So you may have something called Horner's syndrome, which is a temporary droopy eyelid, some mild hoarseness of the voice, a smaller pupil, nasal congestion, and maybe even a headache. All of these symptoms typically resolve within 4 to 8 hours. So should you get a stellate ganglion block for hot flashes? Well, you might be a good candidate if you've tried hormone replacement therapy without success. If you can't take hormone replacement therapy due to medical reasons, if you've had side effects from traditional treatments, if you want a non-pharmacological option, and you may also have PTSD since stellate ganglion block is widely used for PTSD treatment. But the stellate ganglion block is not for everyone. You should avoid this procedure if you've had a recent heart attack, if you're on blood thinners or have a bleeding disorder, if you have glaucoma, pre-existing nerve damage, or certain heart conditions. If you're unsure, please talk with an SGB specialist to see if this is a right fit for you. Stellate ganglion blocks are gaining traction for PTSD treatment, but now we are seeing a growing body of research supporting them as an alternative complementary therapy for hot flashes. If hot flashes and night sweats are affecting your daily life, you deserve options. While this treatment is promising, it's not a one-size-fits-all solution. Your medical history and personal needs should always come first. If you're curious about whether an SGB could work for you, best next step is to talk with a specialist near you. Thank you so much for watching, and if you found this helpful, be sure to like and subscribe, and I'll see you in the next video.